This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. You know, we've been dealing with COVID for a long time, 19 months. We've talked about telemedicine. We've talked about telehealth. We've talked about virtual visits. We've done all of that on the show. But one thing that we really want to talk to you about is a virtual app. And so we're delighted that we've got with us today Mr. Ken Dakin. He's a physician assistant at Children's Health. Ken, welcome to the show.
Thank you. Well, I do appreciate that. I'm glad to help out and serve the community. So I'm glad to be here. And thank you for hosting.
You know, Children's Health has a virtual visit app. Can you explain that to our listeners?
Absolutely. It's an app just like most other apps that you would just download to your phone or to your mobile device to be connected, and allows you to be connected to a healthcare provider. In the same way that you may use Amazon Prime or a Walmart app or Shopify to connect to a marketplace, you can use the Children's Health Virtual Visit app to connect to healthcare providers. And it's just as simple as that. Just as you would go into an office, a medical office, and fill out some paperwork, we're going to kind of ask a few of the same questions, such as your contact information, any allergies that you may have. It gives you a space to put in your pharmacy information and just a few other things that are needed there. And then it allows you to connect to a healthcare provider soon after that. Usually, sometimes within minutes. Sometimes it may take 5 or 10 minutes, but it's usually a really, really quick process.
You know, as we talk a little bit about COVID, but we also have cold and flu season coming as we get into the winter months. How would you envision this app helping families?
So we have providers that specialize in pediatrics and children. We also have providers that can also help their parents and help adults as well. Just coming through the COVID season, as you mentioned, or this recent uptick, it was difficult to get seen or to find an appointment, to find an available clinic that didn't have a lot of waiting times, or just to find an available time slot. So with a virtual visit app or with a virtual visit platform, you can avoid all those waiting times, and you can be seen literally from the comforts of your home. You can be seen from your office. And so it really provides a service just to meet those and provide an extra venue or an extra outlet for people to get the health care that they need. So if they need a cough medicine, or they need an antibiotic, or if they're having some kind of a nausea attack or some vomiting, they can get anti-nausea medicines, or respiratory inhalers if they're asthmatics. So we're here to help with those things. We can identify those problems, and we can meet those needs just as easily through a virtual visit as we could just in person.
Not only convenience, but when you think in terms especially of children, having access to care is so important. And many times social drivers of health impact access to care. How, in your mind, has this virtual visit app increased access in the communities you serve?
Yeah, great question. I see a lot of families that many times are busy with sports, or they're busy with activities or homework, and sometimes squeezing in an appointment time at whether it be an urgent care or their primary care or even emergency rooms, sometimes, and it becomes difficult, to really carve out that extra time to be seen, because illnesses strike at any time. We all know this. Sometimes it's the most inopportune times. And so with an app, it just really minimizes the waiting time and the downtime. It just makes the access a whole lot easier. Families don't have to pile into the car and then rush to the office. They could just manage their space at home. They can manage their daily lives while waiting, connecting to a healthcare provider. And they can be done anywhere, whether it's rural or urban. If an office is just not nearby, or if it's a long drive, we can still connect to them virtually. I mean, literally anywhere in the state, for what that matters, and be able to provide to them the same quality, healthcare that we could have seen them in an office for. I personally love it. I think it's a great way to offer access to a lot of these people who just don't have time to really carve out of their day and to make an appointment, or to take time off from work and to have their child seen at an office. So it really, really makes it a lot more convenient.
When you think in terms of patient privacy and confidential information, to our listeners out there that are thinking in terms of this app, can you give them some comfort that this is secure and it's not something that could be easily penetrated, or, HIPAA violations occur?
Absolutely. We go through great strides. The app is constantly monitored just to make sure that the information is secure, that there's no one else in the rooms when we do the visits with our patients. So it is completely secure. We pride ourselves on making sure that patients feel safe and that they feel comfortable. We even have, other applications within the virtual visit app where they can have behavioral health. And so those are just as secure as the ones where we take care of sick patients just on a day-to-day basis. So I'm completely confident in the secureness of the app, and being able to give patients the reassurance that they can use this service in a trustworthy manner.
So in your experience as you're dealing with patients, would you say, especially in the last 19 months, how are families reacting? Would you say how many people are really using virtual applications at Children's Health?
So the virtual application, especially within even in a hospital where they can kind of connect virtually, there's less contact. Those visits have really taken off. Once patients have tried it, they really appreciate it. We've definitely seen more visits this way than we have in the past, only because it has afforded people a greater access to healthcare. You can see anybody virtually, and it's safe. There's no contact and those kinds of things. So it makes patients a lot more. They feel a lot more comfortable, and therefore they feel more secure this way than sometimes even going in to see into an office.
We've been listening to Ken Dakin. He's a physician assistant at Children's Health, uses their app and their EMR, their electronic medical records, all the time. Great information on that. Thanks for being with us. Next week is Halloween, you know that, and we're going to talk about doing it safely here in North Texas next on the Human Side of Healthcare.
This is the Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome to the Human Side of Healthcare. We're delighted you're with us today. And as you know, Halloween is right around the corner. We want to look at Halloween safety. We couldn't have a better person to talk with us than Liz Petty, who's a public health educator and is with the North Texas Poison Center at Parkland Memorial Hospital. Liz, welcome to the show.
Thank you. I appreciate you having me.
When you think of Halloween and you think of decorations, many times you see glow sticks, glow necklaces, glow bracelets. Can you tell us what you think of these related to safety and how are they used?
Sure. Well, they tend to be very popular around different holidays, Halloween, 4th of July, used at concerts and birthday parties. They're very popular because they're glow in the dark and they're fun to play with. Like you mentioned, they come in necklaces and bracelets. And inside the glow sticks, they contain a liquid called dibuthyl phthalate. And it's kind of a oily, clear liquid. And this liquid can actually cause a lot of irritation. And what you'll see is a lot of kids put that jewelry or those glow sticks where? In the mouth. Often breaking the glow sticks, and then they either get it all over their mouth or their skin, sometimes rub it in their eyes. And so those are the calls that we get a lot and very frequent during Halloween.
So let me ask you, how can they potentially become very dangerous for Halloween parties, or even if you're using them when you're trick and treating?
Yeah, so a little exposure won't be too bad. It's generally tends to be pretty low in toxicity, but it does cause a lot of irritation. And so it might burn the mouth, the inside of the mouth, the tongue, or even the skin. And so the most important thing you can do is rinse that area immediately, especially if it comes in contact with the eyes. You don't want to cause any permanent eye damage if you don't actually rinse it out. So the main message as far as glow sticks is you definitely want to educate children not to put it in their mouths, but it's likely going to happen anyways, especially for small children. And so no worries, you call us.
What's the name of that chemical again if parents want to look it up?
Yeah, it's called dibuthyl phthalate, and it's a little tricky in spelling. But if you just do a quick Google search as far as what the liquid is in glow sticks, you'll find it across many websites, or you can look on our website and find the information there.
You know, if kids do have these glow sticks, or they wear, the necklace or the bracelet, what do you recommend parents tell them about the safety and use of the product?
Yeah, just like many products, it's just important to relay the messaging, not to use things outside of their intended use, right? And so just relaying the message that using things correctly is a way to stay safe. So again, not putting in their mouth. But if you do have very, very small children, they might not understand that messaging. They're very curious. And so we just overall recommend just to avoid letting very small children use these.
A lot of times when you go to Halloween parties, you see dry ice. Do you consider that safe for small children?
Oh, absolutely not safe for small children. Dry ice has very low temperatures, and if a child were to come in contact with it, it actually can really burn their skin, give them a frostbite-like injury. And especially if it's used in really small, unventilated areas or not ventilated areas, it does turn into this gas called carbon dioxide gas. And in very rare cases, if enough accumulates, it actually can cause death. So totally not recommended, especially because it looks cool. Kids want to touch it. Kids want to see it. So definitely not a recommendation from us.
So maybe we should stay away from the dry ice. I didn't realize it could be fatal. Thanks for that information. As you
Absolutely.
prepare for Halloween and parties and the festivities, you have to buy usually a costume. What do you keep in mind when you buy the costume?
Yeah, so when we're thinking as far as poison safety, we're thinking about the Halloween makeup. Right. So a lot of the Halloween costumes, you want to spice up your Halloween costume. You might want to paint your face just to make it all that better. So when you're looking at Halloween makeup, look for wording like non-toxic. And make sure you do a skin test prior to using it. That's one thing that parents don't often think of. Just doing a small patch on the skin, on the arm, and seeing if there's a reaction about 15 minutes later. And if there's not, then it's very likely it's going to be safe to use on Halloween. Just being very careful that your children don't have an allergic reaction on their eyes or their face, right? That's not going to be a very fun Halloween night.
And I guess when you even look at some of the clothing and the mask, you want to make sure they fit as securely as possible and not be too tight, but at the same time, enjoy the party they're at without having the elastic or something really obstructing them in any way. Would you agree with that?
Yeah, for sure. Especially, something for very small children, right? We don't recommend that you use, maybe a Halloween mask that might be constrictive to their breathing. And so an alternative would be to use face paint. And just keeping that safety in mind as far as doing the skin patch test is pretty easy. It doesn't take a lot of time, and it just keeps your kiddos from having a good night.
And we always think in terms of some of the candy and the sweets that you get around Halloween. What are your recommendations to parents, just in general, about candy and the treats that their kids could receive?
Sure. So, of course, something that, we've heard for years and years and years is that, candy might be laced with something or might be tampered with. However, this is very, very, very rare. I think more of a concern that parents might have is that their parents are going to eat a ton of sugar that night. Now, of course, we still recommend parents definitely inspect their children's candy. Throw out any that's unwrapped, and be very careful for allergens, right? Maybe your kid has an allergy to peanuts, so making sure they don't eat those. And then, of course, only accepting treats that are from people you know and you trust. I know here in Texas, marijuana is not legal, but however, there are calls that we get about children being exposed to marijuana edibles because they look like candy. So those things need to be up, away, and out of sight of children. And there's other hazards like Delta 8, which is almost like marijuana, and children can actually get into it, and it can be quite harmful.
When you think in terms also of candy, unfortunately, if you have some bad candy or unfortunately it's been laced with something, how can parents know that they can contact the North Texas Poison Center, and how do they get a question answered, especially in the case of an emergency?
Yeah, that's a great point. Well, the number one thing is that we're actually not only there for just poison emergencies, we're also there for parents who have concerns about possible poisonings. So if there is absolutely any doubt, they can call the Poison Center. We have lots of specialists who are there waiting for your call. And it's simple. You just dial 1-800-222-1222 and know that we're completely confidential and free, and we're open 24/7. We're there simply to provide you with help. So any doubt, just give us a call.
For our listeners out there that may be saying, hey, that's great information, is there a charge or a fee if they call?
Oh, I forgot to mention we're actually free. It doesn't cost you anything to call the Poison Center. Your call is completely free, and it's taken by a nurse, a pharmacist, or a doctor who has been trained in poisonings. And so you're speaking to an expert. That is who you want to call.
We've talked about some of the obvious risk that children face at Halloween, but there are other things that they face, like, unfortunately, almost every year you hear where a small child darted out between cars and may have been hit by a vehicle. What are some of the other potential hazards that you know about that you want our listeners to be aware of with upcoming Halloween?
Yeah, absolutely. So, of course, there are other safety hazards outside of just poisons. And so we recommend always carry a flashlight with you. So you make sure there's enough lighting, stay on the sidewalks, avoid walking on the street if at all possible. Making sure, you always are by your child, making sure they know the number, most importantly, know the address in case of an emergency, know to call 911 if they need to. But again, any doubts or any questions, just give us a call. And it's just keeping safety in mind, making sure, if with this year, things might be a little different, just to make sure you take the time to re-educate your kids if it's been a while since, they've gotten to go out and go trick-or-treating.
And doesn't it just sound extra fun this year? I think Steve and I should dress up and go out as something. We'll have to figure out what that is. We've been listening to Liz Petty with the North Texas Poison Center at Parkland Memorial Hospital. Their services are free. The best place to find them is online, North Texas Poison Center. And speaking of Halloween, we're going to literally talk spiders next. No kidding. Which ones are dangerous? Next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. Delighted you've joined us today. You know, there are hundreds of species of spiders in North Texas, but you really only have to worry about 2 of these. We're going to learn more about that today. We're going to be talking with Dr. Otto Marquez, emergency medicine physician at Texas Health Presbyterian Hospital in Dallas. And yes, we're going to be talking about the brown recluse and the black widow spider. Dr. Marquez, welcome to the show.
Well, thank you, and thank you for having me. It's a pleasure to be on your show.
You know, when you think of spiders that have poison, you know, we think of the brown recluse and we think of black widow spiders. Which states would you say they are the most pronounced in? And would you find them more inside a home or outside a home?
So they're in both places. The black widow spider is basically on every continent in the world except for Antarctica. And the brown recluse is throughout the South, Central, and the Midwest part of the United States. They're found both inside the house and garages and outside. The black widow likes cool areas, and the brown recluse, as the name, both of the spiders are very timid and don't like being around humans, so they stay away from you and would rather get away from you than attack you.
So if one of these spiders, either one, should bite you, would you know you've been bitten? Would you feel it, or does it sometimes go unnoticed?
So the brown recluse takes about 3 to 8 hours before you feel anything. So at first, the brown recluse, you do not feel the bite, but 3 to 8 hours later, you do feel it. Now, the black widow, you will feel the sting right away.
What are some of the symptoms that you get for both kinds of these spider bites?
Most of these spider bites, believe it or not, are pretty much benign. Most people do fine and don't need medical attention when they do happen. They're very rare, actually, but when they do happen, they're actually not as bad as everybody thinks they are. Now, there is, some people that have bad reactions to them, especially with younger children who are smaller. The black widow's venom can cause some problems. So it just depends. But the majority of them are not as bad as everybody thinks. But there is some bad things with both of them that I can go over with you.
So I know you mentioned age. Are there other red flags that should really raise alarm when you have one of these spider bites?
So with the black widow, if you get bitten by a black widow and you have abdominal cramping, abdominal rigidity, start having convulsions, seizures, having headaches, nausea, increased pain at the site, or profuse sweating, or become unconscious or vomiting, those are very serious reactions, and you should definitely seek medical attention, obviously, for those. Now, the brown recluse, you can get chills, fever, nausea, necrosis at the bite site, which means just dying of the tissue at the bite site, or nothing can happen. You can become restless, have weakness, develop red, white, and blue lesions at the bite site with the brown recluse.
A friend of mine unfortunately got bitten by a brown recluse, and he did have to go to the emergency room, and he did have some of the skin around it dying. How does that progress from the time you get bitten till you notice some really discoloration in your skin around the bite?
Right. So at first it's red, and it usually doesn't hurt at first, and then it develops an ulcer in the middle and starts to die in the middle. It can take up to about 3 weeks. Most of those resolve on their own. If you see the spider and you identify that it's a brown recluse or black widow, you call poison control and call your family doctor, or come see us in the emergency room here at Presbyterian if you're concerned about it.
So if you get bitten, say, after working in the yard, and you realize you've got a red spot and you can tell you've been bitten by something, are there any home remedies that you would recommend before
Sure.
you define your problem as being severe?
So the problem that I see is most people don't see the spider. Most people come in with a big abscess or a couple abscesses on their body, and they assume it's a spider. And a lot of times it's not a spider. Unless they see the spider, bite them, that's when they should assume it's a spider. Most of the time, It's not a spider. It's something else like MRSA. But if you are bitten, it's like anything, I would clean it with soap and water right away, because you can get a secondary infection with bacteria. Also, I would put some antibiotic ointment on it. I would put ice and elevate it and call poison control if you definitely saw the spider and identified either of the spiders.
So could you define MRSA, please?
So MRSA stands for methicillin-resistant Staphylococcus aureus. It's a bacteria that's everywhere, and with all the use of antibiotics, they become resistant to certain antibiotics. So you only can use certain antibiotics to kill this bacteria, the staphylococcal bacteria. And usually we can tell it's that. We treat you with a certain antibiotic, and we can cover it with that antibiotic. Years ago, when we were kids, we didn't have much methicillin-resistant staph because we weren't using as much antibiotics. But with the use and overuse of antibiotics, these bacteria that are everywhere have become resistant to most antibiotics, or at least the resistant MRSA bacteria.
You know, if you have, as you mentioned, MRSA infection, sometimes that seems somewhat similar in appearance to a spider bite. Is there anything that helps you differentiate between the two?
Yes, so they're very similar. It's even hard for us to distinguish between a spider bite and the MRSA. Most of those lesions are not spider bites. Most of those lesions are either MRSA or some other bacteria. The spider bites are not as frequent. People assume that it's a spider bite, but they actually didn't see a spider bite them, and they come and present complaining of a spider bite. It's actually not a spider bite. And most are not spider bites. Most are MRSA. And MRSA is tender and it hurts. And the brown recluse doesn't hurt at first. That would be one distinguishing thing. But most of the time, these are not spider bites. I would be concerned with children because they're very small, because the venom of the black widow is like 15 times as strong as a rattlesnake. But the good thing is it's a very small amount of venom that gets injected into you. And a lot of the times it's a dry bite where they actually bite you and don't inject any venom. An adult can take it pretty good, but with small children, they should definitely call poison control and seek medical help if they do see the spider.
You know, you mentioned something in your answer that fascinated me. I know you said that obviously a spider sometimes does dry bites, and when they do bite, they won't inject as much venom as, say, a rattlesnake. But did I hear you correctly? The black widow venom itself is 15 times more potent than a rattlesnake.
That is correct. It is 15 times more potent than a rattlesnake venom.
Wow.
That is. Yeah, but yes. So good thing they're not big like a rattlesnake, black widow spiders. But they inject such a little tiny bit that it usually doesn't cause problems.
You know, Thomas and I have done a lot of interviews, and just about every medical professional we've talked to, whether you're talking about type 2 diabetes, cardiovascular, rattlesnake bites, and now we're talking about spider bites, prevention is one of the key things you can do. And I was going to ask you, I read that if you work out in the yard or you have old work shoes in the garage, you should turn them upside down and shake them good, because brown recluse love that. Is that true?
Absolutely. That is true. Yeah, they love being in shoes. They like being in your garage, and they can be in there in the winter when it's cold, and they can be in your attic when it's hot. They can go weeks without drinking water or eating. But as the name states, they're recluse. They won't attack you. There's places where there's infestations of brown recluse spiders, and people don't get bitten. They're very timid spiders, only unless they get cornered or you step on them or do something like that. And the thing to do is, obviously, they're under logs and in your shoes or between wood, under rocks. So the thing is to clean it. I would definitely do that. And black widows, like if your toilet's outside, they can be around there, those kind of places. The other thing is don't have lights out at night a lot, or at least have the yellow light bulbs, because that attracts insects. And insects, the spiders like, and it attracts those spiders. Eliminate the light, clear the wood, the brush, the grass, around your house. Caulk up your house so they don't get into your house, that kind of stuff. Wear gloves when you're working in the yard, and that sort of thing.
You know, you're so right. I had another friend of mine, and he was wearing gloves, but his sprinkler system was acting up. So he went to the main valve, and he flipped the lid off. And when he flipped it over, there was a black widow right under the lid.
Yeah, the black widows love cool places, but they won't attack you. They won't really attack you. You can even, they have webs, and you can actually, if they're on their web and you mess with their web, they'll actually try to get away from you versus attacking you. Like even if you hit their web, they rather not attack you. They rather go away. So unless he's stuck, unless they feel like they're being threatened and cornered, they'll bite you.
So let's assume you need medical attention. What would you say are the red flags or the point that you should seek medical attention for a spider bite?
Okay, so for the black widow spider, the venom is a neurotoxin, so it kind of it affects your neural system. So if you develop cramping, obviously, or convulsions, or your abdomen becomes rigid, start having headaches, become nauseous, profuse sweating, obviously become unconscious, vomiting, I would seek medical attention. Now, for the brown recluse, it is more of a local toxin, affects the tissue more, and it necroses the tissue, kills the tissue, versus being a neurotoxin like the black widow. And you can get chills, you can get fever, you can get nausea and restlessness, and become weak. Those I would seek medical attention.
This is just a great conversation we're having with Dr. Otto Marquez. He works at the emergency department at Texas Health Presbyterian Hospital in Dallas. Did you know there were only 2 poisonous spiders in North Texas? I didn't know that. So when we come back, let's talk about what do you do if you get bit, but also other critters like scorpions and ticks. Let's talk about all of it at once, next on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing our conversation about spiders in North Texas with Dr. Otto Marquez. He works in the emergency department at Texas Health Presbyterian Hospital, Dallas. So, Dr. Marquez, let's kick this segment off. If you have to go to the emergency room and get treatment, what kinds of treatments are available for these 2 black widow and brown recluse spider bites?
So if you're having a severe, like a allergic reaction to the spider bite, like having difficulty breathing or lips are swelling, we'll give you some IV steroids, give you some IV fluids, give you some Benadryl. But those are the things we would do if you came to the emergency room with those symptoms, if you're severely allergic to any of those spiders.
As you look out to the future and on the horizon, any forms of treatment that will help with spider bites?
So the black widow, there is an anti-venom for the bite, for the black widow, but there's a lot of anaphylaxis to this venom. So sometimes the venom may be worse than the bite. So we don't use it a lot. We just treat the symptoms more and try to stay away from the anti-venom for the black widow spider. The brown recluse, there's no anti-venom for the venom for that. So we treat them both with antibiotics for the secondary infection, and treat the other things like the convulsion, like we do any other convulsion or difficulty breathing or any severe anaphylactic reaction.
You know, we've talked a lot about protecting ourselves around our home, inside and out. But when we leave our normal element, let's say we go hiking or we go camping, any thoughts on how we should protect ourselves?
Sure. So when you go camping, if you're at your camping site, make sure there's no logs or rocks. You're in a clear area. Make sure your tent is pretty tight where it's sealed, where nothing can come in or go into your tent. Wear boots and try not to kick logs over, but usually if you're wearing boots and your pants, you're pretty safe.
For our listeners out there, what message would you like them to keep top of mind related to black widows and brown recluse spiders?
Most of the time, whenever you have an abscess on your arm or leg or any part of your body, most of the time those aren't spider bites, unless you see the spider. And the brown recluse is brown. It has fiddle on its head. It has like 3 sets of 2 eyes, unless you see that. And then the black widow spider is black with a red to yellowish hourglass on its lower side of its abdomen. when you see those things and you get bitten by a spider, I would call poison control and or call your family doctor. And if you're concerned, come to the emergency room and we'll happily see you and take care of you.
Thomas always has excellent questions, and I'll tell you, he does a lot of hiking, so I bet he's got some questions for you.
Well, I wanted to turn to scorpions. What about scorpion bites?
So scorpion bites are in Texas, unless you're hiking in Australia. The scorpion bites here are like a bad bumblebee bite or a wasp bite. Same thing. Not any worse.
Not going to kill you.
Not going to kill you. Not like in the movies. Unless you're in Australia. The scorpions in Texas here, actually in the whole United States really, but here they're not poisonous. They're just like a big bumblebee. Now, unless you're allergic to it and are allergic to scorpions and have an anaphylactic reaction, which we would do all the same things. We would give you the steroids and all that kind of stuff. But unless you're not allergic to it, it's a bad bumblebee bite. And Benadryl, clean it like with soap and water, put some antibiotic ointment on it, keep it elevated.
What about, speaking of hiking, a lot of people do like to go hit the trails, either walking or biking, whatever, and you walk through or you go through a spider web and you probably pick the spider up on you somewhere, but you don't know, and maybe you're hiking by yourself. What do you do?
By yourself, I would try to see if there's anything on you. And most of the time, so black widows have webs. Brown recluse, fortunately, do not have webs. So you don't have to worry about brown recluse. They don't make webs. So the black widow does make webs. Like I said, most of these spiders are very timid. The black widow, you can even disturb its web, and it'll usually try to get away. Now, if you feel like it's on you, I would just try to, I guess, remove your clothing, whatever, as much as you can to make sure it's not on you, and have your partner make sure they don't see a spider on you. But most of the time, you're okay.
I think most of those spiders that we see out on the trails are not that threatening to us.
No.
I mean, some of them, those big black and yellow ones, can look really like, oh, I don't want to deal with him, but they're really not going to hurt you, right?
Spiders are actually very good. They eat mosquitoes. They eat bugs that we don't like. They're actually a very good thing to have around. Spiders are good. I don't worry about spiders, really. I mean, not even tarantulas in South Texas. They won't hurt you either. So whenever you see these spiders, the only two you worry about is the black widow and the brown recluse. And like I said, they're very timid and very rare to get bitten by them. So those other ones you don't even have to worry about, really. I mean, unless you're allergic to them and have a severe anaphylaxis to spider bites, which there is people that have that, like they do the bees or bumblebees or any of those things.
Now, just for context, I remember 3 channels of black and white television. So
I do too.
Okay, all right. So back in those days, there was something floating around, I remember in childhood, where it said, like, if you got bit on your calf, or let's say you got bit on your arm or some area, and a red line started to go up your leg, headed toward your torso and toward your heart. Is that true or not?
That's true. Yeah, you can have that, but that could be from any. That could be. It doesn't have to come from spiders. That can be any kind of. Whenever you have that sign, it shows there's a cellulitis, an infection of the skin, and it's progressing in your skin. And there could be some serious things like that. But that you definitely need antibiotics for that. And that's usually a cellulitis, which is a skin infection caused by whatever, spider bite or another insect bite, or just hitting a nail, or anything that affects the skin and causes an infection.
Okay, now I've had that happen where you don't remember getting bitten by anything, and then all of a sudden you have a little red spot. 3 days later, you have a big red spot, and now it hurts, but it's not going anywhere. Is that what you're talking about?
Yeah, so most of the time, those things, you weren't bitten by anything most of the time. Most of the time, something hit you there. You have a little infection there for whatever cause. You hit a little tree branch or a little stick or something, and it causes the skin to break and causes an infection. And people attribute it to spider bites, but most of the time it's not a spider bite. It's just an infection, a local infection, or sometimes it can also be just an insect bite, and it's not venomous, but it causes a little local allergic reaction, like a little round redness that gets bigger and bigger. Is that what you're talking about?
Yes.
Yeah, that's usually your body reacting to a venom from an insect, but it's not poison. It's just a reaction, a local reaction to that. And that's not dangerous. It can cause swelling and redness like that, but it's not dangerous.
And then what if that redness has the little bit of pussy area in the middle of it with something black in there? Might be a stinger. Should we go digging?
No, I wouldn't go digging. I wouldn't. I mean, unless like a tick bite. I tell people kind of leave things alone, unless you obviously see something where you can take out with a tweezer or something. Otherwise, I just leave it alone. Clean it with water and soap and put some antibacterial ointment on it.
Ticks. Yes, of course. What if you get one and you're by yourself again? What's the best way to get rid of it?
When I was a Boy Scout, we used to get a match and light a match and put the hot match on the tick. I mean, you can just remove it with a tweezer. Just remove it. Lyme disease is not really a problem down here in the South. It's more in the Northeast. If you don't want to kill it with a match or anything, you can just remove it with a tweezer. And
the question there is, did you get the head out of your body?
Right. And those things are, I think those are more urban legend than actually a thing you need to worry about.
I heard that you can use Vaseline. Is that true?
No, that'll work too because you're suffocating it. So sometimes we get like something in their ear, like in their ear canal. And what we'll do is we'll have them turn their head, and what we do is we basically drown it. We put some lidocaine in your ear and fill up your ear canal and drown it, and then we pull it out with a little tweezer clamp thing. But yeah, anything that'll suffocate it or a hot match, that'll kill it, and then you can pull it out. Absolutely.
And a big thanks to Dr. Otto Marquez and the folks over at the Emergency Department at Texas Health Presbyterian Hospital, Dallas, for some great suggestions that hopefully you never have to use. Steve?
Glad you were with us today. Hope you'll stay safe. The COVID numbers are going down. We're very thankful. Let's keep it going down. Do your part. Respect your fellow Texan. Have a great week. See you next Sunday on the Human Side of Healthcare.